Very good evening to all of you, my beloved colleagues, and gratitude to all of you for sincerely waiting for this more expected discussion class today. Today, topic is very important, and we designed the topics in a very different way to be discussed today. With my humble introduction and with the introduction of our institute and the moral alert, though, we like to start now. Just to start that, to tell you what the examiners checklist are there. From there, already you are informed from before that we will be discussing today the number 2 skill here as mentioned, data gathering skill. Data gathering skill in the examination of OSCE especially, it means history taking. History taking, though data means a little, actually meaning a little broader one. I don't like to discuss it here. For exam purpose, we will confine with the history taking. So in the OSCE design, you know that there is a 10 minutes station. We have to complete almost 4 or 5 minutes at best, our history taking. But for technical purpose, though it is not much possible here in our online session, after taking 3 or 4 minutes history, we have to overlap our discussion that you will be talking and looking at your patient. It is possible. Sometime we discussed it before also. Likely that you are asking, do you smoke, do you drink alcohol? In the meantime, you are looking at the fingers, looking at the face or other parts of the body. It is possible. If the history in the history taking, the questions are simpler. So you are doing parallel two things, taking the data and doing the examination. So we will not do this thing today. We will be discussing only the history taking part, and we will try our best how to finish the history taking in the shortest possible time. But for better understanding, we will try to explain you different parts of the history today. Anyway, let's going now to show you in a bigger font. The main focus of the history taking skill is our history should be pertinent and is important information to understand the problem in question. You heard about the focused examination more likely, but indirectly, history also should be focused. So some routine questions and others, there is some importance of asking some routine things. You know also by attending our previous sessions, but all routine things are not important. So what routine things will be important, I will show you or I will discuss you also. But before going to the main discussion, what should be in our mind? What question in our mind during the consultation? Almost these are the questions in our mind, and we will try to get the answers from the patient. Already written here. Even then, I am reading for you. What is the diagnosis? What are the differentials? Other possibilities? Is the patient's condition currently active now? That means, should I need to take any emergency management steps? What information suggests that the condition is active? That means to prove that the patient have situations, the diagnosis or the clinical problem is active or emergency, what information actually guiding me to tell that this is active or emergency? So now, after taking the history, next point, mainly identify the signs and complications by examination. So today's actually performance will not be on examination, but even from the history also, we can identify the complications and easily you will understand. Let's see. How will you investigate the case and how will you manage the case? So already we discussed it, the examination skill, investigation skill, as well as management skill. In the management skill, we remember we discussed about the referral skill also, the referral knowledge about. There are many other small skills as well. So those who are using our basic module, easily you can understand it. Anyway, so if it is the history doctor, just have a look, the overview of the history headlines. It will be a little different than any other history sheet, what we believe. Just you look at that you start with the greet and meet. The number two will be a little different in a sense. Those who are our regular colleague, you will understand. Patient tells the presenting complaints, then immediately next question will be, do you have any other problem? Do you have any other problem? So it is a little different than other traditional history taking. And those who are practicing with us, you understand that how will you reach towards the diagnosis very easily by asking this. Okay. Then history of the presenting complaints or illness. As before, traditionally we organize in this way. First is that OPD CATs, that means the symptom analysis. So how to correlate this thing from the 2 and 3? When you got more symptoms, you just store it in your mind that the patient having 2 or 3 symptoms. But what is the first presenting symptom? You will analyze this presenting symptom in these headlines. This is the mnemonics. Onset, progression, place, duration, character, aggravating factor, relieving factor, timing of the day, and the severity. Timing means the diurnal variation. One additional thing should be here for the pain, especially, that is the radiation. We didn't write the radiation. Actually, we tried our best to make you understand easily analysis of the symptom in these 7 points or 8 points, rather to say, in general. But for the pain, you must add another one. This is the radiation. After asking the symptom, the first one, especially the presenting symptom, usually in the OSCE, patient present with one symptom in general. So then correlate with other symptom you got by asking this thing, do you have any other problem? And then you will be almost confident enough what will be the diagnosis. This is our experience. Even then you ask other symptoms of the relevant system. I'm just explaining for you a little, then we will come to the final. Please just be serious with us. Other relevant system or systems. It means, for example, if you have the presentation, a patient presented with the breathlessness, simply relevant system will be cardiovascular system and the respirology. These are two number, very important. But you know that functional patient also will have the breathlessness. Even the renal failure patient also will have the breathlessness. So other symptoms means there is a symptom box. We will not show you here. You will get from our different post in the group. Or if you don't have at all, you can communicate with us. There are box of the symptoms. It is called cardinal symptoms of the system. From this box, you will ask other symptoms to make a balance in which system your diagnosis is going. Okay. Then ongoing diseases like diabetes mellitus, hypertension, routinely for each and every patient. But if you think relevant, you could ask one other disease, chronic disease from each system. For example, in the respirology, you will ask that, do you have bronchial asthma? Okay, like this. And the general health queries are very important. Loss of weight, body weight. That means mainly loss of weight. You can ask about the weight change rather, increasing or decreasing weight, side by side, loss of appetite. We have to correlate with this, the loss of appetite and the body weight. Then the sleep pattern, fever or fatigability, what else? But 4, I think, in my sense, very important. Loss of appetite, loss of weight, and the fever and the sleep pattern. These are 4. Invariably, you could ask, and it can give us even the nature of the disease, like this is a chronic disease or acute disease, or even it will be severe disease or not. So it is actually up to this point 3 rather. If you complete here, almost you will be almost certain about 80 to 90% clinically, 80 to 85% rather to say about the diagnosis. But diagnosis is not the main thing. For the disease, we have to identify etiology, complication, consequences, comorbidity, many other things. So you will go for the past history. You see, please, the past history of the diseases, medical, surgical, previous happenings, blood transfusion, even the investigation reports also important. So as we will be practicing a little later, you will understand by practical discussion later on. Drug history, these are the points, including immunization, allergy, and the family history. How to ask family history? That is any disease running in your family? Remember the word, I repeat, is any disease run in your family? Somebody will be confused family meaning, especially South Asian countries. Better to mention the father, mother, sister, brother, and son, daughter. Are you, is any disease running in your mother, father, sister, brother, son, daughter if they are married? Better to be asked in this specific way. Social history, many things like personal attitude and others, diet. In the GI disease, diet, invariably you need to ask. Smoking, you understand the cardiovascular risk, alcohol, housing, home help, osteoarthritis patient, housing is important, right? Home help is very important for the social support. Conjugal life, any sexually transmitted disease, or even in the social issues, conjugal life issues, job, income, hobby, trouble, febrile disease, trouble, sexual history, impact of the symptom in life, very, very important impact, how it is impacting your daily life. Then idea, concern, expectation, many times we discussed. So we will not tell more. If you need, you can go through our YouTube also. Many days we are discussing main thing. Even then, if you don't understand, doctor, you can raise the hand. And then systemic review or systemic inquiry, you ask some relevant system there in the point B of the 3 relevant systems. So there are some other systemic inquiry, other systems. You can say these are the routine questions. But in the OSCE exam, sometime you will not have enough time to ask routinely other systemic symptoms. If you can manage your time, you could ask systemic inquiry 2 or 3 symptoms from other remaining systems. Otherwise, you can ignore it. Then summarize the history. Then tell your plan for the examination. That means, can I examine you or can I check you? Already you formulated a systemic diagnosis. Already you formulated near about few differentials. Accordingly, you will design the examination, the techniques. So today we will not be discussing about the examination, but in this, the overall, the history taking. So this is actually, you could get the pre-reading material. You can ask about, we didn't provide possibly pre-reading to you. Today also you will get it in the group, we will provide it. And in addition, already you see there are 3 boxes are there, 3 box. The P bind, 4 ID and 3 PPP, that means the PPP. For the female patient, for the baby, 5 questions, and for elderly, 4 ID. So I hope all of you understood. Anybody want to ask me about this? Otherwise, we can skip now. Please. Anyone to ask me this for the 3 box? Open the mic, please. What does it mean? How to ask? If it is enough for you, explanation given, we can skip now. These could be routine question. If your patient is a baby, then it will be routine question. If a patient is the elderly, usually more than 60 years of age or 60 years, it should be routine question. If a patient is female, especially in the reproductive age, 3P should be asked. Okay. So it is a little puzzling here in your vision. Pregnancy pill and the period. Pregnancy pill and the period. Okay. So in the next slide is mentioned more clearly, P bind, PP, and the 4 ID, pill, and pregnancy in the period. Okay. So if it is enough for you, so for example, as a chronic case, you see that the process going on. These are almost newly developed in the last few weeks. Everybody, you have seen it, the P bind and the 4 ID. So acute emergency in the data, just to tell you that in some points are not, maybe may not be important in the data collection. So we tried our best to make it marked by this trick there, you see. So it may not be relevant in the acute or emergency case, even the opportunistic health promotion. For example, the cardiovascular chest pain, you see that onset, progression, duration, we just customize for your convenience. So in the disease, you diagnosis, etiology, and others. Okay. So we intentionally took a little few minutes in the introduction. So if we come with a case now, please. if this is the patient, actually, may I request to be volunteer someone who will raise the hand just to talk with me, not actually practicing whole case. We would like to share everybody today, almost if possible, if you are interested. Please, can you raise your hand just to understand the scenario and proceed with this data gathering fruitfully, please. Feel free, please raise your hand. Please raise your hand. Dr. Azza, please, can you open the mic? Dr. Azza, can you open the mic? It's not possible to open, Doctor.
Yeah, doctor, can you hear me?
Yeah, thank you, doctor. But can you check your audio, please? Do you have any trouble of the network or other?
I can hear you. Okay.
Yes. Thank you. We can hear you. Any other colleague wants, please keep your hand raising so that we can shift from Dr. Azza to other colleague. Okay. So don't be tired and frustrated also. Sorry, Dr. Nazar here. You wanted to know the link. Already link is shared in the common group. Dr. Nazar, if you are here. Sorry, doctor. Anyway. So, Dr. Azza, please, just can you read the instruction for everyone? Dr. Nazia
Yes.
also. Dr.
Miss,
Nazia, just keep muted but keep your hand raising so that I can identify you immediately. Just, Dr. Nazia, how to keep the hand raising in the Zoom. In the response button, you just the response or reaction button in the Zoom and keep your hand raising, doctor. Dr. Azza, already you are in the
okay.
connect with your open mic, but I'm requesting other colleague, please.
Okay, sure.
Those who want to talk to us, keep your hand raising in the Zoom, please. Okay, Dr. Azza, please go on. In the exam, commonly instruction is as such. Can you read it, please? Can you read it?
Sure. Mrs. Jamila Akhtar, aged 45. Mrs. Akhtar is an ex-patient. Her pulse 64, blood pressure 110/80. Proceed with consultation, perform relevant clinical examination, and make a management plan.
So this is very a common clinical management station, more likely, right, doctor? And
Yes.
in the OSCE, what you will face in future, the instruction actually will not tell you this is acute case or chronic case or counseling case or something breaking bad news, different categories, or even the proxy case. Mother is here to talk about the baby. It is also not clear from there, right, Dr. Raza?
Yes.
So when you start the talk, then you will understand what is the agenda. It is called the agenda of the consultation. So we have to confine with the agenda there. Okay. So Dr. Sama, what do you think? Dr. Azza, keep connected. Don't switch off your mic. You will be continuing, but I'm asking Dr. Sama, please, what may be the type of the cases? Dr. Sama?
Okay. From the I cannot tell anything from just
You
this information.
cannot but guess something. It is the technique, doctor, to do better in the OSCE from the beginning. If you could have some idea, it will be easier. Could it be counseling station, doctor? That we categorize the counseling station in our practice, Could it be a counseling station mainly?
No, because there is examination requested. So I guess not.
Yes. So why you are not telling, Dr. Sama? It less likely to be a counseling station, okay?
Okay, this is a female, so I guess at some point I have to ask about the 3Ps. Her blood pressure is normal, her pulse also is normal, and she is married. Okay.
Married, yes. Mrs. Miss married. Traditionally in the South Asian cultures, Mrs. are married lady. It is true. It is true. So we can say that it is unlikely or less likely to be counseling station. Okay, different categories and others. So
not proxy, yes.
We are not sure doctor is a proxy or not, but less likely to be proxy because her blood pressure is given here, right?
Yes. Yes.
Her blood pressure, not that there's a father or mother or even the babies she is talking about. So her blood pressure is given. So she will be the patient. Minimum try to
Yes.
get the messages from the instruction. Don't be hurried and puzzled from the beginning. Okay, thank you, Dr. Sama. Still
Thank
keep
you.
your hand raised in, Dr. Sama. Just mute yourself. And Dr. Aza, you take this audio now. So from
Sure.
there, how will you start? As we mentioned, doctor, in the history, come to the data gathering format we actually designed for you, and preferably in a marvelous way today, and you will see now. Just see.
Sure.
Proceed with the patient. How to proceed with the patient, doctor? What is the first point?
First point is introducing ourselves,
No,
our name.
no. Greet and meet.
And
Just look at,
yes.
please, everybody
No,
look at the screen. We will be interacting with all of you, doctor, today. Okay, don't be distracted from the screen. Greet and meet with introduction and identification. This is the first point. Whatever the case, right?
yes.
So, Dr. Azak, can you
Yes.
try how to introduce yourself? Your patient name? Can you
Yeah.
remember or forgotten?
Yeah, yes, yeah. No,
Huh?
Mrs. Jamila Akhtar.
Mrs. Jamila Akhtar. What was her age?
She's 45 years old.
40?
45.
45. Sure?
Yeah, yeah. I just
I'm
wrote it
going
down,
back.
doctor.
Yes,
Yeah,
45.
no, I just
Jamila
wrote it
Akhtar.
down in a paper.
Yes. So patient will be Mrs. Akhtar. Patient
Yes.
will be Mrs. Akhtar. And you
Yeah.
see, you might forget the blood pressure and the pulse. Okay. If there is
Mm.
no abnormality there. Okay. But
Yes.
up to
Yes.
these, you can remember that pulse blood pressure was almost normal.
Normal.
Normal. Okay.
Yes.
But one thing is that pulse is near about lower limit normal. It is right.
Yes.
So could it be due to beta blocker or by naturally also?
Mm.
Patient may be on
Mm.
antihypertensive. Many things happen. Let's go.
Mm.
Let's go. After introduction,
Sure.
what will be the
Yes.
second point, Dr. Sama? Wherever
Can you
Dr.
tell?
Gulzar, you raise the hand and lost suddenly. Other colleague raise the hand. Please keep your hand raising so that I can easily identify at the top. Dr. Sama, what is the next point after greeting and okay, let's hear from
Yes.
Dr. Aza. Possibly Dr. Aza is our new colleague. Dr. Aza, can you greet the patient, Mrs. Akhtar?
Yeah, Mrs. Akhtar, yes.
How to
So you
greet?
need to
How to
introduce.
greet? How to greet?
Yeah. Yeah, you need to introduce yourself by saying I'm Dr.
Not,
Raza.
I am not willing to hear a lecture, doctor. I like to hear from you as a role play how to start with. Good morning, Mrs.
Hi.
Akhtar.
Yeah, good. Yeah, good morning, Mrs. Akhtar.
Good
I'm
morning,
Dr. Raza.
doctor. Okay.
Yeah, I'm here for consultation with you. Are you Mrs. Akhtar and are you 45-year-old?
Yeah, doctor. Thank you, doctor, to be in time.
Thank
Okay.
you. Can
So
you tell me
who want to make it better? Okay, up to this enough, Dr. Raza. Who want to make it better if you think? Any colleague? Anyone can open the mic. Who raised the hand? Dr. Sama.
We cannot make it better.
Better,
Hello.
but better to avoid the word consultation. I am here to talk to you, right? Not
Okay.
I am here to
Okay.
consult for consultation.
Okay.
Try to be very casual, very simpler. Okay.
Is it jargon consultation?
I am not telling jargon, but better to say I am here to talk to you. You will be more
Okay.
familiar to the patient, right?
Okay.
Is not
Building
better
rubber.
to hear, doctor? I am
Yes.
here to talk only, right?
Yes.
Like this. Suppose a teacher is telling in the classes to the students, oh, my beloved students, I am here to play with you. Actually, he is here to teach them. She is or he is, isn't it? But teacher
Yes.
telling, I am here to play with you. It is not better word, doctor? Like this. So I am here
Yes, of
to
course.
talk to you, or I am here to
Okay.
see you. Okay. If you tell the consultation, also not bad, but try to use very simpler way. Yes. After this, you identify the patient, introduce your doctor, and you identify your patient. Then, to know the problem, how to start, Dr. Aza? The next sentence.
You need to ask her.
Yes,
Can you
how to
please
ask?
tell me
What?
what's the reason for the visit today?
Oh, Dr. Gulzar, how will you start? Dr. Gulzar.
How can I help you?
Yes, it is our suggestion, advice, Dr. Aza, right?
Mm-hmm.
How can I help you? We think that it is a better word. That means
Okay.
patient will think that doctor is here to help me, right? And
Okay.
simpler, it means many things.
Mhm.
It save you a few seconds also. How can I help you? Can you try, Dr. Raza?
Yeah, sure, sure.
Okay.
Hi, how can I help you, Mrs.
Ha-
Akhtar?
Yes. Patient now telling, please, everybody, those who are sincere, you can write down like a doctor in your chamber, even in the OSCE station. Please write down if possible, or keep in your mind. I will show you slide one by one in interactive manner, doctor, don't worry. But you try your best to keep the record what patient is telling. It is called the attention to the patient. If you cannot try with me today, you will be unable to do in your station also. Concentration, another quality of a doctor. So I am the patient now. Yes, doctor, I am having fever for the last 8 days, doctor. Actually, I am taking the paracetamol. Still, I am having pain, doctor. Please, doctor, help me so that I can get rid of my problem, doctor. Up to this. Then, Dr. Azza, what will you ask the next question?
Can you tell me more about it?
No, doctor, sorry. No.
Mhm.
No, that is very special thing. Actually, I like to, what I say, the communicate with you. This our special rather, if you want to know. That is the question. Do you have any other problem?
Okay.
Right, Dr. Sama? I think you understood.
Yes, yes, doctor.
I am very, very serious about this because I found it is very useful tips. Not that, can you tell me more about this? I think some of you, or Dr., including Dr. Aza, might be oriented with some instructor or the mentor somewhere. And it was a
Yes.
traditional, like decades together before, years together before. Even in my preparation time also, we are asking in this way. But it is a little modification for you to make you fruitful and to get your diagnosis earlier. So, do you have any other problem? But don't forget the main symptoms or main presenting complaint. I repeat, what is the main presenting complaint, Dr. Aza?
Fever since 8 days.
Fever since 8
8
days.
days.
8 days. Okay. And patient getting what drug? What drug? Paracetamol for the
Mhm.
fever, right? Paracetamol.
Yes.
So you understood now drug history already started, isn't it?
Yes.
Drug history of the current illness already started. Patient might be taking drug before this illness also, but already current drug history started. Remember it. Okay. Then patient telling, just give me time, doctor, I will follow. Yes, doctor, I have pain in my right lower tummy as well as I have a headache also, doctor, for the last 8 days. So, Dr. Raza, how many symptoms you got now?
Fever, tummy pain, headache.
Headache. So, can anybody have any idea what could be the diagnosis here? Anyone? Up to this only. Up to this 8 days
UTI.
fever, non-remitting
Could be
fever,
UTI.
UTI. Any other colleague to say?
Doctor, this is typhoid fever. What I think, I'm Dr.
Typhoid
Nadia.
fever.
Who is
With
telling? Who is
relative,
talking?
relative bradycardia. This
Dr.
is Dr. Nadia.
Nadia, fantastic. Why you are thinking this is enteric fever?
The pulse was 65, doctor.
Pulse 64, right? Okay. Then temperature
Temperature and right upper quadrant pain is
39 degrees. So actually, I didn't show you the temperature. You could ask that, did you measure your temperature? You will get it now. When you come back to know the details of the fever, patient will tell temperature is 39 degrees centigrade. So if 39 degrees centigrade, if the pulse is 60, sorry, there is a little mismatch, doctor, I'm sorry. Pulse 60 or whatever the 64, you say, it will be relative bradycardia. So if you think that is a common case in the South Asian countries, it may be a case of enteric fever. Anybody else to say something different? Anyone, please? I'm asking especially those who raise the hand. Anybody can raise the hand also. Dr. Gulzar?
So I think it is okay because typhoid fever.
Typhoid fever. But Dr. Azza said it could be UTI. What is the reason, Dr. Azza, you are thinking UTI?
Because of the tummy pain.
No, what is the features of urinary tract here?
Here the feature could be just the tummy pain and the fever the patient has got.
Fever doesn't specify the location of the disease. Fever is a
Yes.
fever presentation, maybe mainly of
Yes.
the infection. There could be other, what I say, reason of the fever also. Even the malignant disease also can produce fever. But if patient tell that dysuria, right? Lower tummy pain, patient telling right lower quadrant, doctor, okay? Right lower quadrant means there is an appendix, right? Cecum. If the female, there is ovary, fallopian tubes, right? So if the location of the fever we consider, Dr. Nadia, I think you can explain that the source of the enteric fever in the right lower quadrant. Is it true? Dr. Nadia, Dr. Nazia, please. I think you commented. Right lower quadrant.
I didn't comment it, but right lower quadrant pain could be because of many reasons.
Many reasons. But if you say that this is enteric fever, so
That was Nadia, Dr. Nadia. Yes.
oh, Dr. Nadia, sorry, I'm sorry, the name confusing
No
me.
problem.
So right lower quadrant is the area of the Peyer's patches, isn't it?
Yes.
And the inflammation mainly happen in the Peyer's patches for the enteric fever.
Yes.
So what does it mean? Apparently asking only, how can I help you? This, and do you have any other problem? Okay, this. So I am not telling that this is enteric fever right now, but you could get an idea that it may be a case of enteric fever. Clear? Doctor, all of you can tell those who
Yes.
raise the hand. Is it clear now?
Yes, clear, yes.
Yes, clear. So that actually we like to share with you today. And it may be exceptional to you. Okay. So do you have any other problem? Already you got that fever, right lower quadrant, and the headache. Okay. Then ask about go back to the fever details. What will be the next point? Symptom analysis. Okay. May I ask Dr. Sama, analysis the symptom of the fever. Look at the screen to be guided how to ask.
Okay, is it started sudden or gradual?
Suddenly, doctor.
Okay, is it
Sorry,
worsened?
Dr. Sama. Don't guide the patient to tell sudden or gradual, because onset doesn't mean sudden or gradual only. Okay. Patient may
How did it
tell,
start?
how did it start? How did it start? It doesn't mean only sudden or gradual, doctor. Okay. Maybe patient could be telling that, doctor, I was feeling too much pain in my body, side by side. I feel that I become febrile. So patient telling you another symptom also now. Okay.
Okay.
And nowadays in the chikungunya endemicity in the South Asian countries, especially in my native country, patient rather forgetting to tell about the fever. They're telling, doctor, I'm having more severe pain in my joints. Then if I ask, do you have any other problem? Doctor, I have fever also. Up to this enough to diagnose now in this endemic time. Those who are from my native country, you will understand. I think you will be agree with me also. And this is enough to diagnose nowadays. We are facing this thing last 2-3 months, even without investigation also. So asking the second symptom, third symptom in this way, do you have any other problem? So onset can give you an additional message. Yes. Okay, Dr. Sama, proceed again. Yes, doctor. One day, doctor, I am having a headache, doctor, and side by side, I was having the fever, and it started suddenly, doctor. Next.
Okay. Is it this fever? Is it continuous or coming and going?
Actually, doctor, when I take the paracetamol, I told you, it is becoming a little less, but not, doctor, going down as usual, as normal, doctor. For the time being, again, I got the fever, doctor.
Okay. Is this fever starting high at the start of the day and becoming down till the end of the day?
Not so, doctor. Almost last 8 days, it is a high fever. But only today I feel a little less, doctor. Initially, I measured the temperature. It was 39. Today, doctor, I checked and I found it is 38.6 degree, doctor.
With this fever, any sweating?
Yeah, doctor, especially when I take the paracetamol, I become sweating. Then I feel a little less fever, I told you.
Okay. Any shivering?
Not much shivering, doctor.
Did you notice this fever at a specific time of day?
No, no, doctor.
Apart from paracetamol, did you notice anything make this fever better?
No, doctor.
Did you notice anything make this fever worse?
No, doctor.
Okay. So with this fever, you said you have tummy pain. What this tummy pain looks like?
Oh, sorry, doctor. I think I requested you to just to finish the symptom analysis. This one. Okay.
Okay. Okay.
So what other symptom patient told now? Dr. Sama, be with us, no problem. Other symptom
Okay.
in our second point is ask other symptoms of relevant system, right?
Yes.
So I just mark the font size is smaller because you have to store this information in your mind. Then your next headline is ask other symptoms of relevant system. So if fever is there, right? Okay, you already came to know that initially it was right lower quadrant and headache you are getting. But our next point are the symptom of the relevant system. So what will be the actually relevant system here? As patient having right lower quadrant pain, what could be the
GIT.
relevant system?
Vomiting?
No, no, asking the system, doctor, not symptom.
The
GIT.
urinary system and the bowel.
Could be bowel. Is his appendix, cecum, or the colon,
Yes.
or
Urinary system.
urinary
Urine.
system, yes. Or
It could be yeah, reproductive system. Could be ovarian also.
yes, ovarian or the fallopian tube, whatever. So because patient is female. But as you asked from the beginning, do you have any other problem? Patient already told you that right lower quadrant pain. Actually, surrogate is guiding to reach your diagnosis. Rather, surrogate is helping. If you didn't ask the previous question, that one, do you have any other problem? Patient will not tell you. If patient didn't tell you, you need to ask the questions of all the systems. You will be blind. Where is the fever coming up? For example, patient tell nothing, only the fever. You can start from the respirology, start from the GI tract, start from other many way. But as patient told you, the second symptom as the right lower quadrant, you could ask from there. 3 systems are there. So how to ask about from the 3 systems? Dr. Sama.
Okay, with this fever, you have any, with this fever and tummy pain, do you have any loose bowel motion?
No, doctor. Rather, I am having now feeling hard stool, doctor, in the last 1 or 2 days. So what you
Okay.
got now? Just try to learn in a chunk, little, doctor. Sorry, I am stopping you because our topic is only data, how to collect the data very perfectly. So already patient told that there is a constipation. What you are thinking now? Could it be a disease of the genital
Intestinal
tract?
obstruction?
No, I am asking, could it be disease of the genital tract, urinary tract, or GI tract?
GIT.
More likely GIT. Okay? The
Yes.
constipation. So next question, Dr. Sama, what will you ask?
Any vomiting?
Yes, doctor. I have vomited yesterday, doctor, one time.
Does it contain food or blood?
Yeah, doctor, food sometime, doctor, not blood.
Okay. Uh,
Now to stop you, Dr. Sama, as we are thinking, right, lower quadrant, many anatomical organs are there. So already we got the data that the disease actually coming from GI tract, right? Appendix or cecum or terminal ileum there, and the vomiting also there. But even then, we cannot make sure that it is not due to UTI until we ask, do you have problem in your water work? Do you have problem in your down below?
Water
No,
down
down
below.
below means the genital tract. So though you are thinking that I got the diagnosis, okay, this is one way. It is a good you got the diagnosis. But as a clinician, is the clinician's responsibility to exclude other possible differential. As we were thinking, right lower quadrant pain may be due to UTI, for example, okay, ureter or right side of the bladder, for example, maybe due to reproductive tract. We better need to ask specifically from there. It is again called focus question. We try to say focused history also. So how to ask, Dr. Sama?
You okay. Now we make a differential diagnosis and exclude the others.
So you ask the question next, urinary tract question and the genital tract question, please. I already told you, you just repeat this.
Okay. Do you have any problem with the water with the
water work, Dr. Layman term is
work?
water work. If
Yes,
anybody say
sorry.
urine, no problem, but it is our traditional learning to say water work. Excellent word. So no, doctor, no. Then
Do you have, yes, when was your last period?
7 days before, doctor.
Do you have any problem from down below?
No, doctor.
Yes.
Up to
Okay.
this enough. Almost 95% you excluded. As patient told you, the right lower quadrant pain. Understood, Dr. Sama?
Yes.
So you are almost certain that disease of GI tract. Initially, Dr. Nadia was there. She nicely diagnosed enteric fever. So now you are more confident to say it could be enteric fever, right? Still, you have the weapon of the examination, many other things. So you asked about relevance. Now, another symptom, what about headache? Is that it?
Yes.
I am just for brainstorming, I am thinking that headache is the cardinal symptom of which system? Anybody can say. Cardinal symptom of which system?
CNS.
Yes, nervous system.
Neurology.
Neurology. So could there be any disease in the nervous system produce fever and headache?
Yes.
What is this?
Meningitis.
Meningitis.
Yes.
So could it be meningitis now?
It is a red flag, so we need to exclude it.
No, I'm asking, can we think that it could be meningitis? Dr. Gulzar also. Dr. Azza, please. Those who raise the hand, you just take part in the discussion, in a group discussion.
Because
Dr. Nader Jubran. Dr. Jubran, please keep your hand raising so I can easily identify you. Keep your hand raising. Dr. Jubran, could it be meningitis?
We
Jubran telling nothing.
cannot exclude meningitis now. Because
But we know the disease. Meningitis is very severe disease. Patient usually will be having some other neurologic problems. What are those? Maybe confused, right? There might be some convulsion. Isn't it?
Yes.
Yes. But patient
Mm.
does not have it. Moreover, patient have symptoms guiding us to think about the GI tract mainly. Isn't it? So if you make a balance of the systems, if you make the balance of the system, your patient mainly of the GI tract disease, not from the nervous system disease. Because patient does not have any other symptom from the nervous system. But why headache is there? It is due to the vasodilatation by the fever. Understand?
Yes.
This is the accompanying symptom of the fever. So patient having the headache. This is the basic inner understanding of the patient. Okay, sorry, doctor, I am going slowly to make you understand. Don't think that why time is very long now. I believe that after finishing this, you will have a structured data gathering, ideation in your brain. It will have very little time to finish everything, but discussion taking long time. So the next question, after reaching this, and you are almost certain about your diagnosis now, in the history, you did an exam right now, only the vital sign data given, pulse, temperature, and the, what I say, blood pressure. Okay. If patient does not have the breathlessness, respiratory rate also not important. So now ask other many informations in the data. So if you reach the diagnosis, it is not enough, because you will be a family physician. You will have, your approach will be holistic approach. Now we are asking about the chronic diseases patient having or not. It is actually called as comorbidity. Does patient have comorbidity? This comorbidity may be relevant with the today's presentation, may not be relevant with the today's presentation. If it is not relevant with the today's presentation, but it might be treated also. For example, like diabetes, hypertension is not controlled, we must treat the patient today. Okay. So can anybody say if patient have the diabetes, hypertension, is diabetes can be relevant with today's presentation? Doctor? Dr. Aza
Yes.
left. You become tired, Dr. Aza, or busy somehow. Dr. Sama? Yes.
Because diabetic patients have, they are more prone, if this is
Yes,
comfortable, they will be
more
risk.
prone to have infectious disease. More prone to have infectious disease. So it can give even a diagnostic clue also to us. Okay. And for the management purpose also, we need to take diabetes. So now, again, Dr. Sama, don't mind. Dr. Azza, can you open the mic as you are the first one to be with us? Dr. Azza, can you ask the next question? How to ask this thing? As you are new, for that we are guiding to you. Dr. Azza? Dr. Azza somehow. Anyway, Dr. Gulzar, please ask this question. Chronic disease.
Do you have high blood sugar?
No, doctor.
And do you have high blood pressure?
No, doctor. It may be one question, okay, Dr. Gulzar? But I refresh my answer just to make my checklist, okay? All of you try to remember. Can you ask me again? Do you have?
Do you have high blood pressure, high blood sugar?
Yes, doctor.
And do you have high blood pressure?
No, doctor. What will be the next question?
Any other?
No, doctor. You didn't finish the diabetes informations. Only asked, do you have high blood sugar? Yes,
Okay.
only. What will be the next
Right.
question?
Are you taking treatment for diabetes?
It could be relevant, but already in our history taking sheet, there is one headline. It is called drug history.
Drug history.
So we will ask the drug history in the drug history paragraph. Otherwise, you will be lost with the diabetes only. But whenever we get the disease, we must ask the duration of the disease in the chronic disease. So what will be the next question?
How many years you have this?
How many years? Why you are telling years, doctor? It may be only 6 months.
Okay.
How to ask?
How many months you have high blood pressure?
Doctor, it could be
high
2
blood
weeks
sugar?
only. It could be 2 weeks only, doctor. Why you are thinking months?
Okay.
So how
you
to
will
ask now?
them?
Huh? Dr.
Can you
Sama?
explain for me?
Oh, no. Dr. Sama, how to ask the duration?
For how long you have this?
Yes, how long? This is called open question. This is the glamour of communication skill. Don't focus that what you are thinking. It may not be true. So how long? Understand, Dr. Gulzar? I think everybody understood how to ask the duration. How long only? Non-specifically, how long? Okay? How long? So you got it. Up to these, you are satisfied. No need to busy with the diabetes, because diabetes is not the presenting problem today. Patient presented with something else. Okay, diabetes is a chronic disease. We will be dealing with it later on. Okay, fine. So now come to the next question. General health queries. General health queries. What are those? I told you fever. Already you got the fever. Then sleep. Then loss of weight and loss of appetite. Who will ask now? Any new colleague to ask these 4 questions? How to ask? We'll be happy if Dr. Azza come back. Otherwise, Dr. Gulzar can ask. Dr. Gulzar, please be with us. Ask these general health queries. Weight,
Okay.
appetite, sleep, fever already asked about before. So these 3 questions.
How is your appetite?
Doctor, I couldn't eat in the more, doctor, as usual in the last 1 week.
And do you lose weight? Or
Yeah, doctor, maybe near about 1 to 2 kilogram, doctor, in this time. Okay. Then about the sleep, doctor.
what about your sleep?
Yeah, doctor, for the body aches and the headache more, doctor, I couldn't sleep also in the last 4 or 5 days.
I'm sorry for that.
Enough. I'm sorry. This is a consultation skill, rather, to say I'm sorry for this. Very good, Dr. Gulzar, as you said. Okay, fine. So general health queries, you got it now. Okay, general health queries, loss of weight, body ache. I have body ache. Already you now how many symptoms you gathered now? Please, who can say me? How many symptoms you gathered now up to this? Doctor? Please, anybody respond. How many symptoms you gathered? Anyone, please? Those who are actually listening me, please respond.
Fever.
Dr. Mona, please. Fever.
Fever, headache,
Headache.
lower tummy pain.
Very good.
Body ache.
Body ache.
Sleep disturbance.
Sleep disturbance.
Loss of appetite. Decrease of appetite.
And loss of weight also.
Weight loss. Weight loss, yes.
So how more you need to say your diagnosis right now? How more you need to say this is a critical problem now? Patient already lost body weight. So moreover, you got some background of diabetes. Still, we are not telling this is control or uncontrolled. Patient is hypertensive. So your patient today is not only with a simple fever or febrile disease. Anyway, Dr. Mona, why not you keep your hand raising, doctor? Are you busy? So that we can ask
Yes,
early. So you got the general health queries now, and be in the next headline, number 4. So we finish history of present illness. That means including 4 points. It is our format, doctor. You may modify it according to your suitability. Many years we were working with this and we devised in this way. Now come to the past history. So we try to highlight in the past history previous diseases name, medical or surgical treatment taken. That means the hospital admission, definitely surgical, usually day care or in the inpatient, and the blood transfusion. Importantly, investigation. Importantly, investigation. It could be additional things are there also. Dr. Mona, please, how to ask this past history?
You have any similar condition like this?
Before?
Before, yes.
No, doctor. But I had fever only 2-3 days and it is gone after taking only paracetamol.
And have you ever admitted to hospital for any reason?
No, doctor.
You have any long-standing medication?
Long-standing medication. No, doctor, I didn't have any other disease also. Why should I take?
You said before you are diabetic.
Yeah, doctor.
You take anything for diabetes or you are in lifestyle modification?
Thank you, Dr. Mona. You jump to the drug history now, right?
Yes.
So you can say
Surgical
that
technique.
the medical treatment about it is a very gross superficial word here. As the next question will be the drug history, you see, I will show you, but rather keep the detailed drug in the later part. Okay, medical means here any procedures. Okay, in general medical treatment that I got this thing or injection or other things in general word, but a specific thing could be asked in the drug history according to the format. Otherwise, if you be busy with the medication of the diabetes, you will forget to take the drug history later on. It may happen. So it will be risky. So again, coming back, medical or surgical history, if you think that blood transfusion could be relevant, suppose jaundice patient, blood transfusion is very important, history of blood transfusion previously, you understand, but you may ignore the
Yes.
blood transfusion. But in the diseases, doctor, you asked about the, did you have any other illness like this? It is very right. So like this, but patient might be suffering from other problem before, not like this. Is not there, Dr. Mona?
Yes.
So
Yes. Yes.
after asking this, did you suffer from similar problem before? No. So what will be the next question? Did you have any other problem before? Or did you have any other disease before? Then patient could say, yes, doctor, I have even enteric fever 5 years before. It is very common also. Can you
Yes.
remember? Can you remember? Especially in our South Asian colleagues. Patient might have recurrent enteric fever. Our assumption
Yes.
is enteric fever today. Okay. Patient might have recurrent, recurrent or the second time dengue also. Is that possible?
Yes, possible.
For this reason, we need to ask in this way. First time, similar illness. Second question, do you have any other illness? Any other illness means disease started and finished. Okay.
Yeah.
For the answer from the surrogate, I am telling to you, yes, doctor, I have actually the operation for my baby delivery 10 years before. And at that, okay, 10 years before, what will be the next question? Important according to our checklist. Is patient telling that 10 years before there was a surgical history?
The, what about the surgical scar? It is healed or there is
Yes, the scar was healed,
some
doctor. There
discharge?
is no scar. It is fine. No, doctor. I like to highlight
There
this blood transfusion is as mentioned in the surgery, cesarean section more likely for the delivery operation. Patient could have blood transfusion. If patient is not telling, did you take blood? Do you know at the time of operation? It may be the question. So as a data, I am telling you now from the patient side, yes, doctor, I took 1 unit of blood at that time, doctor told me. It is also important positive history. It may be relevant, may not be relevant. If patient presented with the jaundice, definitely it will be very important to know. But it may be any additional data for us. It is also data, but with the today's presentation, it may not be relevant. Okay? But it is important history. This is called the data gathering. If you skip it, your data will not be completed. Okay? Fine. Investigation about doctor, how to ask. Dr. Mona.
You do during this 8 days, you do any investigation or you
But doctor,
seek
not the,
any medical.
sorry, not the investigation. How to ask the investigation? Dr. Gulzar, please. How to ask the investigation?
Do lab test.
Lab
Do you
test.
have any test before?
Yes, better to ask in this very simpler way. Did you have any test done before? Before means during this illness, more likely patient would have some investigation done, some test done. Already 8 days now illness, is not it? Patient
Yes.
seen by other doctor or somewhere. Even then, patient might have investigation done in 10 years before. In the cesarean section time, her blood group was A positive. Maybe only simple data. So those having the blood group A positive, usually blood group is not changed. So you will not do this investigation again today. But if you ask Dr. Gulzar again investigation, ask me now. Dr. Gulzar.
During this,
Dr. Mona is
during
to
this,
ask? Okay, no problem. Dr. Mona.
during these 8 days, you do any lab test or any test?
No, doctor, no test done. I was trying by taking the paracetamol only to get rid of the problem. I didn't go to any doctor also, doctor. Then next question about investigation.
Today, you do,
Doctor,
you do any investigation today?
Not today, doctor.
Any lab?
Why you become blind only with the today's presentation? Patient is diabetic for the last 5 years.
You about diabetes, you do investigation, you follow with your doctor?
Yeah, doctor. And the 1 month before doctor, I was actually I have gone to the sugar clinic. The sugar clinic doctor done many tests and he told me that everything was quite fine. Actually, surrogate will tell you to rather I'm not telling destruction. Surrogate actually will guide you to the fever and other things, not about the diabetes today. Understand? It is not the station of diabetes. Today's agenda is not diabetes. But as a doctor, for the holistic approach, we are asking this as a routine, rather to say, for relevant for the patient. Any test done before for your illness? Illness means current illness or the previous illness. It is important. For example, if you think that patient telling, yes, doctor, my sugar and other test done 2 weeks before. Okay. Our symptom is duration 7 or 8 days only. 2 weeks before done. So you could ask, what was the hemoglobin A1C? Can you remember this? Yes, doctor, my hemoglobin A1C was 8.9%. Is not relevant also today? We have to treat it also. Not only treatment for the febrile patient, we have to treat the sugar also. If I cannot, I will send the patient to the specialist if possible or if needed. So this is the thing, investigation. It is again, I like to say, doctor, this is our intentional addition in the headline past history. Okay. It is past history word, very simply past history, not past history of illness. We are not asking only illness. We are asking the illness. We are asking the treatment. We are asking the investigations data also. It is very technical thing. It is my humble introduction and addition, doctor. I believe I worked on it many days, many months, many years. It will be useful for the next planning because you will tell later on, I am now planning to do some test, Mrs. Akhtar. So 2 weeks before hemoglobin A1C done, will you do again hemoglobin A1C today for the diabetes? No.
No.
If I don't know the hemoglobin A1C status, I will repeat. For this reason also, a complete investigation data important if patient have a chronic disease. Otherwise, not much important. Only investigation or test for the current illness is enough. So these all doctor past history. If you can complete these, it will be more than sufficient in your past history. Okay. Even blood transfusion are only relevant because patient told that I have done the delivery done by the cesarean section. Okay. Now come to the drug history. Who will take the drug history? Any new colleague?
Me.
You? Thank you, Dr. Mona. Please ask the. So I am just showing you this. Already you gathered the data in your memory store. Now come to this point 5, drug history. So medication list, compliance, allergy, immunization. Ask now one by one.
Are you in long-standing medication?
Yes, doctor, for my sugar.
What therapy you use?
What therapy, doctor? Why you are telling very different word, therapy? What medicine you are getting?
What medicine?
Yes, doctor, I am taking the metformin 500 milligram 3 times, gliclazide 800 milligram 2 times. And already, doctor, I told you I am taking the paracetamol 500 milligram 3 times for the current febrile problem, doctor.
And you take it as your doctor said?
Sorry, doctor?
Are you take it as your doctor
Advice,
said
yes,
for you?
doctor. Yeah, by the doctor advice I am taking.
Are you allergic to any drug, any
Not,
medication?
not known, doctor.
Are you take immunization like BCV or an influenza
Immunization.
vaccine?
Sorry, doctor, I don't understand what is
Vaccine.
the immunization, doctor.
You take vaccine
Vaccine. Oh,
for
doctor, yeah. For what, doctor? My mother told
BCV
that. My mother told that in my childhood, the vaccination was up to date.
because you are diabetic. You need to take BCV and annual influenza vaccine. You take this year,
Oh no,
or
doctor,
you take before.
I didn't take the influenza vaccine, doctor.
And BCV, have you ever take from you develop diabetes?
BCG, doctor, you mean?
BCV, pneumococcal vaccine.
Oh, sorry, pneumococcal. No, doctor, I didn't take.
You
So
have any
a-
complication?
any more
From,
information about the drug? Yeah, what about?
you have
Complication?
any complication for your medication?
Again, you were telling the jargon word, doctor. Complication.
Yes. Yes.
How to ask again? Repeat the
Any side
question.
effect?
Any side effect? Rather choose the side effect better. Patient understands
Yes.
side effect, not complication. Okay?
Yeah.
If patient does not understand side effect also, we can say in another word also. Okay? Though today is not the consultation, is skill discussion. Even then, it is relevant today. We can say that did you have any problem after taking the medicine? Enough. Did you have any problem after taking the medicine? No, doctor, I don't have. But metformin can cause GI upset. It is true also. Right? Patient could say, patient could say no problem. So for this reason, side effect also important of the drugs. Whenever patient takes the drug, side effects of the, so like allergy, it is also side effect, is not it? But it is an immunologic side effect. Dangerous side effect could be there. One thing. So Dr. Mona, did you finish the drug history?
You take any medication recently rather than paracetamol for
No, doctor.
this illness?
No, doctor. Any more question? Any more question? Can anybody, any colleague doctor to say us any more question about that only in the drug history, anything remaining? Patient is Mrs. Akhtar of 45 years. She's regularly menstruating lady, so she is not pregnant.
Contraceptive. You take any medication for birth control?
No, doctor. Maybe no, maybe yes. But common answer will be yes, doctor. I'm taking the birth control pill for the last 8 years. Okay. So this is the trap. This is the trap you might forget in the drug history. OCP, actually patient doesn't understand this is a medicine. They thought that this is a pill only just to stop the birth. But OCP is a medication to us. OCP can create the side effect also. Isn't it, Dr. Mona? Where you gone, doctor? So up to this enough for your drug history. I'm happy to know that you completed this thing as a drug history, including influenza, pneumococcus. This is very fantastic nowadays in the adult the vaccination. So my beloved colleague, don't forget, especially patient is diabetic or any other organ disease. The next headline. So I don't know how much you are writing today, doctor, those who are enthusiastic with us to gather the data. As a surrogate, I am trying my best to give you the data more and more for your better understanding. Later on, we will summarize it. No, now come to the point number 6, family history of the disease and the death. Family history. Dr. Mona, can we invite other colleague, Dr. Sama? Dr. Sama.
Yes.
Dr. Mona will be on the line also. Dr. Mona, please keep your hand raising so that I can pick up you easily. Dr. Sama, ask the family history.
Do you have any family member with similar condition?
No, doctor, right now, no.
Any family member with sudden death?
Sudden death? Yeah, doctor.
Yes.
Yeah, my father actually died due to his heart problem, doctor.
At what age?
50 years.
Okay. Sorry to hear about
But
your father.
okay. But my mother, my other members, they are fine. They don't have any problem. Finish.
Okay.
Finish. Up to this enough. Up to this enough. Why I am telling doctor? Actually, surrogates also ready to guide you to be with the fever and headache and other, not with the heart disease, not with the diabetes. For that, surrogate also will give you a superficial answer, even by him or herself, a spontaneous information. My mother, brother, sisters, they are quite fine. It means that you don't need to be busy with the details because time is short. Surrogate also understand that your time only 10 minutes, you have to finish everything. So surrogate will not make the thing complicated for you. But if you don't ask, you will lose the marks. It's called complete history, complete data. So after this drug history, we switch to the family history. So family history is finished. Dr. Sama, what will be the next question? Dr. Nader Jubran is here to ask maybe the next question. Dr. Jubran, ask this next one. After the family history, we are going to the social history. Dr. Jubran, can you ask one by one? But tell me, Dr. Jubran, can you open the mic?
Yeah, yes.
Please.
Yes, doctor.
In you patient, until now, we have given
Yeah.
many social history there, social mobility, personal life, many other. What symptoms or question will be more relevant of today's patient? From there.
About the social history.
Yes. Already shown to you in the screen. What you will ask? Invariably, you will ask about.
With travel history.
Doctor, you jump to
No,
the travel,
yeah,
skipping the diet,
we
doctor.
start with the diet. Okay, we'll start with the diet.
Yes.
Okay. Do you have any unusual food?
No. I will give you the chance to ask the question in a proper way, but I am asking you diet you will ask about then.
About the smoking or what?
Smoking, doctor, this one. Will you ask about the smoking?
Female patient?
No, doctor.
No.
Why no? Are you not following whole scenario today, doctor? What are the problems of your patient till now? It is only fever. It is a presenting problem. No. Patient have the diabetes. Patient father, what I say, the early death of the father in the family. Even patient does not have any symptom, any other thing. Smoking is a routine question, doctor. Alcohol, smoking.
Yes.
So you cannot ignore it. Smoking and alcohol. Okay. Then it is called the mental mapping. You are mapping in your mind what you need to ask. Housing. Do you need housing? Very relevant here. Ask about housing.
For the housing, if there is anybody at home is sick.
Yes. If we ask about the housing, actually any helping hands there or not, right? With whom you are living, personal life and others, it can be covered by the housing, but not the structure of the house, multi-storied building or other, right? Usually multi-storied building and other may be relevant with the musculoskeletal symptoms, okay? Aggravating and other things, okay? Home help under the housing rather indirectly. Is it important? Home help?
Anybody helping you at home?
Yes. Is it important as a data?
Crowding and this one.
Could be. No, I am asking home help system or available home help facilities. Is it important for today's patient?
Like
Answer will be
somebody
yes.
helping at home?
Doctor, answer will be yes. It is not only for today's patient. It is important for each and every patient. Home help. Okay? For each and every patient. It is not for the diagnostic clue, doctor. It is for the management purpose. So, management purpose, what are the question We need to ask for each and every patient. Each and every patient.
Every patient.
Every patient. Then conjugal life. Do you think that is more important for febrile patient today? Conjugal life?
Or conjugal.
No,
But,
not more important. As we already got the diagnosis, we reached to the diagnosis, most probably is enteric fever. Conjugal life will not be. Conjugal life usually relevant with which type of disease? Sexually transmitted disease,
STD?
doctor. STD.
Yes.
STD.
STD. Yeah.
STD. So we are not thinking STD at all here, right? Already we asked about the genital discharge, right? Down below. Answer was no. So unlikely that there will be having any issues in the conjugal life, extramarital relations and others. Better not to ask. Okay?
Okay.
Job. What is the job? Important here? Yes, occupation important for each and every patient regarding the earning. Okay? Environment important. Income. Wherever the job, there is income. Important for each and every patient. Hobby may not be important, but hobby will be important for the asthma patient to have a pet in the home or like this hobby. Travel now important for any febrile patient. Travel is important. Okay, any febrile patient, travel is important. Conjugal life and the sex related issues is very important. Sexual history is the details about, right? So as it is not STD, again it is not important. Understand? I am just preparing you how to ask later. Impact of symptom in life. Always important for each and every patient. Okay. Now you can summarize, Dr. Jubran, you ask now. Social history of the patient. Social history. You ask now, doctor.
Yeah, it is important.
Talk to the patient.
Sorry, may I ask?
Dr. Sama, to ask anything, please.
How I will ask about conjugal life? Can you give us like a question?
With whom you are living? With whom you are living? Understand?
This is the conjugal
Yes.
life.
Indirect question, with whom you are living.
Okay.
But somebody asked that, are you married? I'm sorry to say it is not very standard word, are you married? Because in many societies, even in the South Asian, so somebody is living together without marriage. Understand? It doesn't mean that they will have the sexually transmitted disease. Just simply living together without marriage. Is that right, doctor? Right. So, in general, good question will be with whom you are living. With whom you are living.
How to include the sexual
If
history here?
wait. If patient doesn't understand with whom the patient is living, then asked, who is your partner? These are traditional words. So when you ask who is your partner, they will not think that who is your business partner. They will think that life partner. Understand now? So usually surrogate will tell that my wife or husband is my partner. Now come to the sexual history. How to ask? Okay. As today's data is not guiding us to ask about this physical relation related question, actually we will skip it. Okay. Dr. Sama?
Yes, clear.
Even then you like to hear how to ask?
No, I just asking in general.
In general. But how to ask means you need to prepare the patient, especially for this question. It is called signposting. Dr. Sama, how to make yes, signposting. Please post the sign.
May I ask you some sensitive question, private questions?
Private question. Yes, doctor, no problem.
Are you sexually active?
Yes, doctor.
So I will start the sexual history here.
Okay, you
it is
continue
related
for
to
other
that,
colleague. They will be benefited. Please continue as you raise this issue. Yes, I am active.
Is it single partner or multiple partners?
No, doctor, only with my husband.
Do you have any extra marital relations?
It happened many days before, doctor.
Do you use any protection
No,
during this?
doctor. No, doctor. It was very, many days before, only one time, doctor. I forgot it also, doctor, actually, what happened at that time.
Okay.
So up to this enough,
Who-
doctor. Okay. For
Yeah.
example, up to this enough. You are thinking that is not relevant also. Why will I ask? Okay. We can discuss it later, doctor, in any other session in detail. Okay. Up to this,
Thank
you
you.
raised, you opened the issue. Thank you very much. I think that other colleague understood. What actually we learned from there, to ask about the private issues, we have to make a signposting. Okay. And not sensitive, Dr. Sama. Better to ask private. Okay. Sensitive may be irritating the patient. Not comfortable word, sensitive. I think good word will be in a private question. Okay. For the exam purpose. But in the real life, we have to use some more word also. Mrs. Akhtar, would you mind if I ask you, or if I have some informations regarding your personal life? Okay, maybe you may be more gentle also, if you have enough time. Anyway, so there's enough for your personal life issues and others. So now come back to Dr. Jubran. Dr. Jubran. Why?
Yes, doctor.
Why
Yeah,
you left? You just keep your hand
disconnected.
raising. No problem, doctor. Can you ask other
No,
thing? Please ask other thing. Other thing. Diet and others.
about the, so about, I will start again about the
Yeah,
diet.
yeah. You start from the beginning in the social history about the
Okay,
diet.
okay.
You are talking to Mrs. Akhtar.
Yes, okay, Mrs. Akhtar. I would like to ask about your diet. How about your usual habit of food? What are you taking?
Sorry, Dr. Jubran and all of you. To save your time. To save your time. You are
Only
again,
short.
you are again signposting that. And now I like to ask you about your diet. Clear? My suggestion, no need to signpost here, because it is very as usual question. Signposting mainly relevant for the private informations. Otherwise, if you say for each one, I like to ask you about smoking, I like to ask you about alcohol. So how it will be funny?
It will take time.
Direct question, doctor. What about your diet?
Yeah.
Proceed, doctor. Proceed.
Okay. Next one, smoking.
No. Start from the diet.
Diet. Okay.
What about your diet?
Yeah. How, Mrs. Akhtar? What about your diet?
Yeah, doctor. I'm trying to follow the sugar diet, doctor.
Okay, good. Do you smoke?
No.
Okay. And you take any alcohol?
No, doctor.
Okay, good. How about your house?
Doctor, do you think that asking house is relevant in this patient today?
No.
No. So why you're asking? More relevant question. You finish fast.
Yeah. Okay. For the okay, what do you do for your living?
Yeah, doctor, I'm housewife.
Housewife. Okay, and anybody helping you at home?
Yeah, doctor, my husband is helping. He's very
Okay,
good husband, doctor. Dr.
What
Jobran, better to say very nice. Not
very
only home,
nice. Okay,
doctor. Yes, very
compliment.
nice. Yeah, it's called
Good.
appreciation. Very nice.
Yeah. Okay,
Because
very nice.
some husbands are not helping, doctor. It is true. Okay.
Yeah.
Then.
Okay, what do you do in your free time?
Doctor, actually, I am busy with my family, so sometimes I sew some clothes and others, but not fixed with any job. But I pass my leisure sometimes hearing songs.
Okay. So, did you travel recently?
No, doctor. better to ask recently means in the last 1 month, 2 months. Okay, not recent will be
Did you
non-specific.
okay? Did you travel in the last month?
No, doctor.
Okay.
Enough. Up to this
Now
enough. The last question, very red question.
okay. Okay. So these symptoms, how they do affect your life?
Yeah, doctor, last 1 week I couldn't do my household work, doctor. I couldn't prepare my foods. And my husband also to be busy with me, and he couldn't go his office also regularly, doctor.
I am sorry to hear about this.
Very good, Dr. Jabran. Impact always will be there in consultation, and always you will feel sorry for that. Remember it. Okay, I'm very sorry to hear about this. Very nice, Dr. Jabran. You have done very nicely. So it took a little more time. I think all of the colleagues understood how to take the social history. Okay. So as I said that there is no, because our agenda today is not here. Okay, our agenda is the fever, headache, right lower quadrant and other thing. It means indirectly your probable diagnosis of enteric fever. Okay. If any issue could remain here, the surrogate could tell you, yeah, doctor, I'm smoking last 20 years, 30 cigarette every day. Then you will be busy with this. So usually a station is not designed in this way. A station design would have very important one focus, main agenda. We have to be able to pick it up, point it out, which is the main agenda. And it is very easy also, you understood today. Okay, smoking is not the main agenda. Whenever your station will be counseling station, definitely patient will not have fever, other many things. But as a routine, you are asking the smoking, then you got a smoking, patient have the cough, relevant symptom, then you will be busy with the smoking. It will be, then categorically, it will be counseling station. I think those who are attending with us in the last few weeks, you understood what are the examples of the counseling, right? So up to this, a social history. Now, the next point, idea, concern, expectation. Okay, doctor?
Okay.
So I think Dr. Jubran, Dr. Mona can continue now. Idea, concern, expectation. Dr. Jubran, keep your hand raising, doctor. Dr. Mona? Not getting Dr. Aza. Dr. Aza started with us today. Dr. Aza, if you are free, please raise your hand. Dr. Mona, open your mic, doctor. Idea, concern, expectation.
Mr. Akhtar, Mrs. Akhtar, what do you think or cross your mind the cause of this symptom you have?
Doctor, possibly I am having dengue, doctor, because many of patients I found surrounding me, doctor.
I hope not. And what in particular way do you like to meet?
No. Why
For you
are
today?
you? No. Why are you worried for? This is idea that patient thinking she is suffering from dengue. Okay. Then concern. Why are you worried for? Please repeat.
What are you worried for?
Not where, doctor. Why? Lay.
Yes.
Why? Please repeat.
Why are you worried about it?
Doctor, why are you worried for? Why are you worried for? Doctor, who can try? Why are you worried for? Doctor, sorry, Dr. Mona having maybe trouble to say these words. Dr. Sarma, why are you worried for? This is actually layman version of the concern. Why are you worried for? Who can ask? Dr. Sarma, please.
Why are you worried from?
Yeah, doctor, some people, doctor, died due to the dengue, doctor. So, doctor, I'm afraid that if I have the dengue, I may die, doctor.
I can see how this can make you feel, but don't worry, I'm here. We'll help you. So, apart from giving you What do you expect
Expectation.
from me
No,
today?
doctor, don't say more
Yeah.
talk, doctor. You will lose your time. After hearing the
Mm.
concern, if patient concern is wrong, even no need to give the answer also right now, because patient is not going to be collapsed. Only telling that I am worried for that I'm if I have the dengue, I will die. Just keep in your mind, because you have to say in summary at the last part, you have to give the management plan later, not here, doctor. Remember, if you start to manage here, you will lose many other things. Understand?
Okay. Okay.
So you just note down the concern, idea, concern. Then the next thing is expectation. Okay.
Mhm.
The 3 points
Okay.
should be there in your consultation, in the OSCE for each and every case almost. So how to ask this expectation?
What do you expect from me today?
Expect, okay, it may be question, but in direct way, what I can do for you. Okay.
Okay.
And both are
Okay.
good. So patient, doctor, give me very good treatment so that I can get rid of my problem. It is a very general expectation of the patient, but patient may expect something different also. Don't think that always patient asking the treatment. I think those who are working in the Middle East country, whatever the patient back pain and other, patient suddenly told, doctor, can you give me sick leave? Is not it, doctor?
Yes.
This is very fact. Daily laborer, they want sick leave, not the medicine today. Though medicine is their expectation, but main expectation is sick leave.
Sick leave. Yes.
I think in this Izaza, is it, Dr. Sama? Izaza?
Gaza. Yes.
Izaza. So this is the version. For this reason, we have to ask ICE, idea, concern, expectation. So it is our best way to guide you, doctor, how to ask. So after this, so it is not relevant with your diagnosis, right? It is a part of your holistic approach and consultation. Already you diagnosed the case earlier. So don't think that, I'm sorry to say, some colleague couldn't pass or some colleague have bad in the last OSCEs. They are thinking that I have done well, my diagnosis was good, everything is fine, even then I couldn't pass. What is the reason? My answer is, humble answer is, these are the reasons. You see how much informations are there in a patient data. In addition, we have to ask idea, concern, expectation. Okay, still your consultation not finished. The next line, systemic inquiry. This is plus minus, doctor, for the diagnosis and others. You could skip it. And most of the time, you have to skip it, I believe, because time will not be there. Anyway, if you have time, systemic inquiry from the other system, what you didn't ask about. Okay, I am not telling you detail. The last one, summarizing the history. It is very critical. Okay, even you may skip the summarizing. You skip in your mind only. No need to share with the patient, because in the instruction, you need to examine your patient. So after examination, your diagnosis will be more strong and you will get more data. So at the end of the examination, you will summarize the patient. But in some stations, written as examination is not needed. At that time, you need to summarize the history right now. So doctor, taking a deep breath now, whom I will ask to tell me the summary of the patient today in the history, not examination and others. Please, anyone I could ask. Those who didn't talk to me, please, from there. Today I found 35 doctors now connected till now. Anybody else to say me the summary? Anyone? Please feel free. Are you doing something else other than listening me, doctor? Sorry.
Can I do?
Yeah, anyone, any new colleague better. We will appreciate. Dr. Mona.
Mrs. Akhtar?
Yes.
Mrs. Akhtar,
Dr.
you,
Mona.
you came today because you have
Doctor, I
fever.
am giving you tips. Dr. Mona, I am giving you tips. This
Yes.
summary should not be more than 30 seconds. Should not be, doctor. Okay? Otherwise, you will lose your time practically. should not be more than 30 seconds. So finish 30 seconds. I am counting the time for you also, doctor, in the stopwatch. Please summarize.
Mrs. Akhtar, you came today before you have a fever for 8 days and associated with headache and body pain and lower tummy pain. And you concern it is your idea it is dengue fever, and you concern this is complicated with this, and you expected strong medication. That is all, or you need to add anything?
Thank you, doctor. That is all you finish in 30 seconds. But the diabetes and other is not relevant, doctor, here to say?
Yes, must said
Because
you have
because we need to discuss about the diabetes treatment also, right?
right.
Because hemoglobin A1C is what I said you 7.9 or like that.
It's 4.5.
So it is also as a matter of discussion, though patient didn't tell about this, right? If I don't have time, I will tell you, okay, I will tell about the treatment of the diabetes in the second session, or not second session, in the next visit.
At the end of the session.
Or
yes.
at the end of the session, whatever. Just to say, show you examiner that you are addressing this thing. So don't miss this thing, those. But again, in the combined clinical case management, you will tell it later on after examination. Okay? But your presenting problem summary is good. Rapidly, but not too much rapidly. Sound should be clear, voice should be clear, and within 30 seconds, it is possible. It is possible. If you practice a little more, in and about 30 seconds, it is possible. Simply tell that you have diabetes also, as well as your father died earlier, I'm sorry to say. Do you like to add anything more? Finish. I hope all of you today heard about this. This is the summary. Because it is called cross-check. I might be wrong. I might forget something also. Just to cross-check with the patient, everything is okay or not. You may miss something, don't worry, like this thing. In the management part, you can raise the issue again if you remember, no problem. Then, after summarizing, question will be, can I examine you? Okay, doctor? So our history data main part is finished now. Any history is missed? Important history? Sometime this history missed, especially the female patient. But today, did we miss any menstrual history? Possibly we missed something. Only we asked about LMP, 7 days. Okay, period. Isn't it? Doctor, who can say Dr. Sama? Dr. Sama was from the beginning. Any menstrual history is important more other than LMP?
We ask about also birth pills. And do you have any kids? We didn't ask.
Doctor, menstrual history is not about the kid.
Is it regular?
Regular. Okay. Maybe in the menstrual part of the history, we have to ask 4 or 5 questions. You could ask even dyspareunia. But is it relevant to ask many other informations about menstruation today? No.
No.
But LMP, lazim, must. Isn't it? Whenever patient in the reproductive age, whatever the disease, pregnancy there or not, LMP can give the answer. Okay. So these are the tradition, including the OCP in the reproductive age. So no remaining menstrual history is there today. But I have shown, because this is the experience. We asked many things, but we didn't exclude pregnancy. That means we didn't ask about the LMP. For this reason, I have shown you. Fantastic. So up to these, what could be our differential diagnosis? Our priority is, usually by the history, we tell some differential diagnosis, 1, 2, 3, 4. Because examination part is there. Okay. So how to make a serial as acute febrile illness invariably you will say that number 1 will be enteric fever. What could be other than enteric fever, though maybe rare? Body ache, headache, fever, just crossing the 1 week, little going down in the 8th day, history of
Bionephritis?
vomiting, pyelo. Patient doesn't have any urinary symptom, doctor. I am telling by the symptom only. Dengue fever could be acceptable. Any other?
Malaria?
Malaria could be there, but malaria fever usually continuous, unlikely, and there is no history of trouble to the endemic zone. So better not to add malaria. But if patient resides in the malarial zone itself, then malaria. Especially falciparum malaria, there could be continuous fever. And interestingly, my area, personal area is a malaria zone area, and whenever we are thinking enteric fever, always we are thinking malaria. In that respect, you are right to think about the malaria. Any other? Could be chikungunya, doctor, nowadays, right? So anyway, these are the summary of today. Everybody have a memory of this. Okay. Before telling the summary and other things, we shouldn't forget most of the informations. And the fever also, nature step ladder. Oh, sorry, it was missed. What is the nature of the fever? It was actually going up. It is a step ladder pattern. And again, other symptom, patient didn't tell you high color urine. A surrogate didn't tell about any urinary problem, but there could be high color urine as a concentrated urine. It may be features of the dehydration. Okay. So overall, these are the summary. In the right side, pulse, blood pressure given, including the temperature. So very easily we can formulate now what could be. And these are the enteric fever features. In summary, and this is our differential: enteric fever, dengue fever, chikungunya, including the malaria. I am very happy to know the differential from you, though we took long time to make you understand. But in this way, we need to take the data. Okay, but don't be afraid that in your exam it will take near about 2 hours time. As we are explaining today, very slowly by chunk, so we took long time. But in practice, you should be within 4 to 5 minutes to take everything. So you need to do the practice and practice. Many things will be in the mind what we discussed today. We don't need to say to the patient. Just ask the question and get the messages. So this is the main part of your data gathering, and this is our differential. Then you will go for the examination. But overall, doctor, a little generic discussion. In any disease, there would have hard symptom, there would have soft symptom to reach a diagnosis. So if you say that fever is hard symptom of the enteric fever, no, because fever is non-specific features. But if we say right lower quadrant pain would be hard symptom, it can be accepted because it indicating the source of the disease, and the right lower quadrant is a disease called enteric fever happened there. So in our history today, right lower quadrant pain is more valuable than the fever. Understand, doctor? So you see example of the soft symptom in the bottom: dizziness, lightheadedness, tiredness, back pain, headache, wind. These are non-specific. So these does not carry more value for the diagnosis. But above, many other symptoms. So I don't like to read it. Just try to remember that in the symptom analysis, we need to understand what is the meaning of hard symptom. For example, hypothyroidism. What could be hard symptom? Cold intolerance. More important than weight gain. Weight gain can happen by the more diet. So cold intolerance will be more important. So it could be hard symptom. Similarly, there could be hard sign also. For example, in the hypothyroidism, prolonged relaxation of the, what is that? Delayed relaxation of the ankle jerk. Delayed relaxation of the ankle jack could be a hard sign because it more happen in the hypothyroidism. So hard symptom and the hard sign. Okay, doctor. And in the formulation of the diagnosis, we actually made a formula from ourselves. Easily you can see there. It is called the rule of 2. Just correlate the symptom. Fever is non-specific, but right quadrant pain is a more important hard symptom. Maybe more likely this is enteric fever, including headache and other. So minimum 2 feature will be there. So one example of the breathlessness given here as if patient present with the breathlessness, if patient having the central chest pain, so it is a cardiac disease. If patient have the breathlessness with the productive cough, it will be respiratory disease. Patient have the breathlessness but having no other symptom, it may be metabolic problem, maybe renal problem, urinary, like this. If patient have the breathlessness with multiple symptom in the multiple parts of the body in the young lady, it could be psychiatric disease. So rule of 2 actually meaning
Or anemia?
Anemia, breathlessness with anemia. So it may be hematologic disease. Again, anemia is the features of the iron deficiency due to the GI tract disease. If patient have the GI tract symptom, it may be GI tract disease including. Just to make a simplified, calculated way to reach the diagnosis. This is only our proposal, doctor, nothing written in the book. I hope it will be useful for you. Even by the symptom analysis, you could reach the diagnosis. Okay? We say it rule of 2. Rule of 2. And our patient again, our diagnosis will be enteric fever, and you will get the tenderness and other many other thing, doctor, blood pressure and other thing. So management, today's patient management, whenever we think enteric fever, our plan will be admission. And moreover, there is other clue also for the admission, uncontrolled diabetes, comorbidity also guiding us to have the patient admitted for the further treatment. And other thing, prognosis is the matter of, it is not the matter of today's discussion. Finally, you need to make a problem list, not only diagnosis of enteric fever, doctor, because you need to talk about what today, doctor. Doctor, don't be what I say fatigued now. Till now, more time we have taken. What are the main problem, doctor, today to discuss with the patient? First thing is the enteric fever, treatment of this. Second,
Diabetes.
Okay, diabetes as a disease. Third, you look at there, then identify also third. Idea, concern, expectation, doctor. Always include in the management idea, because patient have wrong idea, right? You are thinking this is dengue. Sorry, you are thinking this is enteric fever, but patient thinking this is dengue. Okay. So idea, concern important in the part of your problem list. Never forget it, doctor. Never forget. We discussed many times before in the management part, what usually candidate do the mistake. Maybe available in the YouTube also. So in the management part, you include the idea, concern, expectation, including smoking, including alcoholism or other problem, even the financial problem. Patient doesn't have money for further test and others. Okay. In this way, you need to write the problem list. In reality, in the exam hall, doctor, actually, you will not have write this point, what is shown there. Impossible, doctor, to write everything. Only remember this thing and write only the problem list. This is my humble suggestion to save your time. Okay. If you write each and everything, you will be lost in the middle of your consultation. Time will be gone. But if you write the problem list, it will be more helpful. In the management part, talk about the problem list one by one. Okay. In the last 2 or 3 minutes. That's all from today. Any interaction, doctor? I'm sorry I took a long time for you. Maybe not easy for us, but if it is any of your help, it will be our pleasure, doctor. Any comment or any suggestion or any discussion of today?
Thank you a lot, Dr. Usman. Thank you.
This
This
is very
helpful,
pleasure.
helpful lecture.
Our pleasure. But for you, doctor, examination plan and other, actually, I don't like to say. Already we took investigation and examination skill. You can see there, doctor, the link available, especially those who are using our module. It is open for everyone. Examiner sheet already we have shown. There are main 4 headlines of the skill. You must improve your understanding and performance in the skill. You will be given the mark by the skill, doctor, not by the diagnosis. Remember it. So, doctor, thank you very much. A long time we passed, near about 2 hours. My heartiest
Thank you.
gratitude, doctor, to be with us until the end. That's a lot. Keep us in your prayer, doctor. All the best. Ma'assalam. Ma'assalam. Ila
Jazakallah
al-liqa.
khair. Thank
Ila
you.
al-liqa.
Thank you.
Ila al-liqa.